It's really sad for me and my kids.
A South Bay family mourns some disturbing new numbers when it comes to COVID-19's impact on the Filipino community in Southern California.
ABC 10 News reporter Michael Chen reveals why the number of coronavirus deaths is being called alarming.
Rick Malacas, a nursing assistant at Scripps Chula Vista, first felt sick in late June. Body aches followed by a fever and a positive COVID test. More than a week after the symptoms started, he sent a message to his wife, Will, in the next room.
And he texted me that he had a hard time breathing.
She rushed him to the hospital. Days later, he suffered a stroke and was placed on a ventilator. He passed away on July 11th, leaving a wife, a grown son, and a 13-year-old girl the couple adopted in December.
He's my soulmate, and it's really sad for me and my kids.
Will's life hardly the only one impacted. An LA Times headline noting that Filipinos are dying of COVID-19 at an alarming rate. Data compiled reveals Filipino Americans account for more than 35% of COVID deaths in the state's Asian population. This even though Filipinos account for about a quarter of Asian Americans in the state. As for their mortality rate, a staggering 40% in Southern California, although the sample size is only about 50 cases. Joanne Fields, who co-chairs a local Filipino COVID task force, points to possible factors. Many Filipinos live in larger households, work in the health profession, and have health-related issues.
Filipinos have a high number of underlying medical conditions like type 2 diabetes, high blood pressure.
Rick is among those who did have an underlying condition.
I don't know what's gonna be after now that he's gone.
Michael Chen, ABC 10 News.
Fields is calling for outreach programs similar to a county program appealing to the Latino community. She says she's heartened by the number of Filipino contact tracers, which has gone from 2 to 14 since the program started.